Our patient is a 60-year-old African-American female, and as you can see, she's got rolls of excess skin with the fat on her abdomen. Well, she also has an umbilical hernia, and she's been growing some fullness in her central abdomen as well. So we're going to look for hernias at the same time as we do the tummy tuck. I do have a general surgeon coming on in to help us fix it. So with the tummy tuck, we are going to remove as much of this extra skin, they're called paniculi, as possible. We're going to tighten up her underlying muscles and see if we can get her as flat as possible. I'm also going to do a bit of liposuction right out here to help contour her a bit as well. All right, here we go. These are our markings. We're going to try to remove all of this excess skin from her lower tummy. She is going to have a scar that's going to go from hip to hip, and we're going to do some liposuction out here and out here to help take that in as well. She does have a little umbilical hernia, so we're going to have a general surgeon come in to fix that. All right, let us get started. All right, we're all done. Everything went great. We took a lot of skin off her. I'll show that to you here in just a second. She had 4 hernias, believe it or not. She had one in her belly button. There was one above it that was big that we didn't see, and she had 2 inguinal hernias down here and here, so it was good to have that general surgeon to fix them. She does have the scar that's going to go from hip to hip, and we'll show you how she heals here in the future, but everything went super smoothly. Here's the skin that we took off of her. As you can see, it is a lot, and she's going to be very happy because, man, we took a lot off of her today. So I'm so excited to show you now. She is 5 weeks out of her tummy tuck surgery. She had 4 hernias repaired at the time as well. Everything is healing great. You can see just how flat she is. And this is at 5 weeks. And what you're going to see is that over the next several months, she's actually going to get smaller. And she looks so much better than she started, and it's just going to get better. She does have a hip-to-hip scar from here all the way out to here, and that is going to continue to heal real nicely. Her belly button scar is healing very, very well. And now that she's 5 weeks, she's pretty much unrestricted on her activity. She loves walking, so we're going to get her moving. And what she's going to notice, like I said, over the next 6 months is that's just going to get flatter. So this is a good example of holistic plastic surgery. This is a 60-year-old woman who came to see me, and prior to surgery, we had her cleared by her doctor. She had a battery of tests to make sure that she will actually tolerate the surgery well. We knew she had at least 1 hernia, so I had her see a general surgeon who is an expert in hernias, and it turned out that she had 4. At least 2 of them we did not know about until actually going in to operate. Prior to surgery, we had her on our nutritional supplement protocol, and this was something that helped to maximize her nutrition. We also had her take the certain ones after surgery to help reduce inflammation, to help her with her microbiome, and to hopefully heal faster. We did the surgery in a hospital, not in the 12th floor of an office building. She spent the night in the hospital that night. The nurses got her up and walking, and then I did personally see her the morning after to make sure everything was good and she did well. So now you can see she's healed great. The surgery itself was about a 4 to 5 hour operation, made much longer obviously because of those hernias that we had to fix. And here she is at 5 weeks doing amazingly well. So this is what I believe is a great example of holistic plastic surgery, putting safety first, the whole body first, taking it from nutrition to the actual surgery to all of the healing. So I hope you enjoyed watching her amazing transformation.